Hey you guys, it's me Adam Deshawn here with another video. So this video is going to be a very concise video about the pros and the cons of travel nursing. Now I don't know why I thought I had addressed this already, but I think I had addressed it like here and there in different videos, but I've never made a concise video about the pros and cons of travel nursing. While I have, you guys go ahead and like that, hit that subscribe button, and go ahead and like and comment below about your pros and cons about travel nursing even before I get into it. So here we go. So we're gonna start with the pros. The first pro, of course, of travel nursing is the money. You get paid money. You get paid a lot more money than you would be paid at the bedside. I mean, not at the bedside, but working locally. Now, that has been the general rule, but I think after the pandemic, a lot of facilities now kind of are being a little bit more aggressive with their pay. So now sometimes you can still make some pretty decent money locally, but as a general rule, you will be making more money as a travel nurse versus you staying and working locally. So the second pro about travel nursing is the flexibility. Who does not want to work 13 months out of the year, 26 months out of the year, and be able to get to say when or where they work? That is the autonomy that you have as a travel nurse. You work when you want to, in some cases, how long you want to. If the contract is 13 weeks, sometimes you can just tell the recruiter, I'm only looking to do 8 weeks. I'm only looking to do 4 weeks. Of course, the longer the better, but the flexibility of travel nursing is absolutely a pro. You get to choose when you work, how long you work, and where you work. So awesome flexibility as a travel nurse. Also, a pro of travel nursing is new experiences and new places to live. That was one of the most exciting things I think I experienced while I was a travel nurse. I experienced these new places that I would have never vacationed or went to. You guys know I went to Iowa. I went to Portland, Oregon, El Paso, Texas, Arkansas. I've been to Arkansas before, but those other places were so different. These were places I would have never thought to go to, and I had such great experiences in these places. So that is also a pro of travel nursing. You get to experience new places and also work and make money while you're experiencing a new place, almost like an extended vacation, so to speak. Another pro to travel nursing is that you learn a lot while you're working. When I was in El Paso, I worked on a med-surg oncology unit. I worked on a med-surg trauma unit. So I learned so much stuff. Back home, I only worked long-term care and just med-surg, but I learned, and I floated to so many different places. And when you float, you have to learn things. So you learn a lot, and you have a lot of different nursing experience while you're traveling. And this could also lead to you maybe changing specialties. I know I got floated to the ICU a couple of times. Granted, I did not take care of real authentic ICU patients, but I still learned a lot from the nurses, things I had never learned before, things I had never saw before. So learning new things and having new experiences in nursing is absolutely a pro to travel nursing. So now let's talk about the cons. There are cons, believe it or not, there are cons to travel nursing. The first, I wouldn't say this is a con, but this is something that you really have to be mindful of, is that you really need to be really independent. You really need to be an independent learner, because once they, as a travel nurse, you're gonna get a few days of orientation, maybe, but more often than not, they're going to expect you to jump in there and start work almost immediately. So you have to be a really independent learner and really be independent about your own education, because at the end of the day, you're responsible for what you know, honestly. They can orient you, but you are honestly responsible for your own nursing license. You're responsible for your own knowledge as far as you caring for different patients. So you have to be really independent learner and an independent worker as a travel nurse. The second thing I'll say about a con about travel nursing is sometimes it can be unsafe. And when I say unsafe, I'm mostly talking about you're in a new environment, you're in a new situation, you don't know the city you're in. So sometimes things can be unsafe. I'll give you an example. When I was in El Paso, we were very close to the Mexican border. Like, I could look out of my hotel window and see like the Mexican border. There was a street that I would have to pass through on my way to the hospital. And I thought it was a street. I didn't think anything of it, but I learned from a nurse that there a lot of carjackings happen on that street because it's very dim. It's very dark. And when I was leaving work at the time, it was dark, me coming home, and I would pass through that street. So I didn't realize that was an unsafe area to be in at that time of night. So you're in a new place. You are not really familiar with your surroundings. So in some cases it can be unsafe, but you have to be very vigilant. And also too, people need to know where you are, what you're doing. You need a contact person if you're going to be out of the state or out of the wherever you are travel nursing. So that can be kind of a con. It could be a safety issue. Another con is that people can be kind of rude to you at the work. And maybe rude is not the best word, but being that you're a traveler, people are not going to invest a lot of time and energy into getting to know you, being nice to you, because they kind of figure that you'll be here for a few weeks and then you're gone. So people don't make the effort. So maybe rude is not the best word. Maybe sometimes people are rude. I know there was a lot of rudeness during the pandemic because us travel nurses were coming in making 3-4 times what the local nurses were making. So they were kind of salty about that. So rudeness can be a thing, but I think it's more or less people don't really make the effort because you're not going to be there long. So why make the effort to get to know you and stuff like that? So it could go one way or another. Another con is missing family. Now, those of you, I miss my boyfriend terribly while I was gone. Like I said, I didn't see my immediate family much anyway, so it's not like I missed them, but my boyfriend I did miss terribly because I saw him on a daily, sometimes weekly basis when I was at home. So missing family is definitely a con. There were nurses I was with that had husbands and wives and children, and they were gone for like weeks at a time. How they did that, I don't know, but being homesickness is definitely a con to travel nursing. Another con to travel nursing is you having to live out of a hotel or quote unquote live out of a suitcase. Now, this is something that I really had to get used to, being that you are in a place for a very extended amount of time. Typically, when we go out of town and go on vacation, it's not really a problem. You like not having your home amenities when you're on vacation. But if you're going to be somewhere for like 3 months, that can be really annoying. My longest assignment is when I was in El Paso and I did 13 weeks. But at that time, I was living out of a hotel. So I did end up buying me like an air fryer. I ended up buying me like a skillet so I could really cook. And so I tried to make my hotel room as homey as I can. But it can really be an inconvenience, you not having these home amenities, and you're going to be in this place for an extended amount of time. So that is absolutely a con. Also, another con to travel nursing is benefits. A lot of companies don't offer you benefits, or they only offer you benefits during the duration of your assignment. So if let's say for instance, there was a nurse I worked with who couldn't travel just because she had a really sick daughter who insurance was a thing. She couldn't be without her health insurance. So that is absolutely a con when it comes to travel nursing, is making sure that you have health insurance. And also, there are no retirement plans when it comes to travel nursing. Now, these things, some companies, you can set these things up and contribute to these retirement funds as you're working. But what if you're not working with that same company consistently? Sometimes that can get kind of messy. So benefits is absolutely, not having benefits and not having consistent benefits while you're traveling is absolutely a con to travel nursing. So you guys, thank you guys so much for tuning into this video. Please like and subscribe if you have not already done so. Also follow me at Adam Deshawn on Instagram. That way I post there more frequently than I do YouTube. And I will see you guys in the next one. Happy nursing. Bye.